Good morning, everybody. Yatehe, Ehaniwashde, Buju.
Buju.
And for my Klamath friends, Waklisi. Good morning, I'm Mark Cruz. I have the honor and privilege of serving as Senior Advisor to Robert F. Kennedy Jr. in Washington, D.C. Yesterday I hit 4 months in this role, and today I'm here to provide some updates from the agency. But we're really building off a really strong start this year and a number of visits across Indian country. As many of you know, this is my second appointment. In the first Trump administration, I had the honor of serving as a Deputy Assistant Secretary for Secretary Zinke and Secretary Bernhardt and Assistant Secretary Sweeney. And I was living home in Oregon, kind of golfing and watching my Oregon Ducks. And Secretary called me in the spring and asked me to come and help him out. And I said, "Are you sure you have the right number?" And he was like, "Look, I really need somebody who has worked with the tribes and understands federal agencies to come help me out and make the most." And I have to really say, the Secretary has a genuine and deep commitment to Indian country. So we're gathered here in Seattle on the 50th anniversary of the Indian Self-Determination Education Act. And one of the things that we've challenged ourselves to think about is, it's great we've gotten this 50 years, but what do the next 50 years look like? We're also gathered on the 70th anniversary of the Indian Health Service. And one of the things that we ask Indian Health Service is, how do we make sure that IHS has the resources and the structure to meet the needs and demands of a modern healthcare system, and do so knowing that we are the 18th largest healthcare organization in the country? So these are all things the Secretary really cares about: promoting self-determination and making sure that IHS has the resources and capacity that it needs. But as I was heading out here and gathering my thoughts, one of the things that dawned on me was just the importance of this organization, and more so in the connections that are made here. And I think about my own personal experience in my first NCAI in Reno in 2013, where people who are no longer with us in this world, they took me under their arm. And I'm thinking about former Chairman Michael Finley and former Chairman Robert Shepard. And, these guys really took a chance on, the young guy in the room, and made me feel welcomed and really empowered me and really helped me have the confidence to go serve my tribes and work on Capitol Hill and take other appointments. And so, this place is a very special place for me and the connections that we built here. So I hope you all take that with you. But back to HHS, the Secretary is very focused on making America healthy again. And one of the things we're doing is ensuring that we can deliver on making America healthy again through a reorganization. And so before I came out here, I worked with his office and the Deputy Secretary's office, and I got a commitment that no matter what we do on that front, we're going to make sure that we have tribal consultation as a part of that. The Secretary remains very engaged in Indian country. In his first year, he visited Navajo. He visited an urban Indian clinic in Phoenix. He attended the Self-Governance Conference. We visited the Oklahoma City Urban Indian Food Pantry. We held a tribal roundtable in Idaho with Governor Little and the tribal leadership from the 5 tribes in Idaho. We visited Nez Perce. We were up in Alaska for the MEGA meeting and had the opportunity to visit Chief Isaac in Fairbanks and fly out to the Tanana Village at the confluence of the Yukon and Tanana Rivers. We had a wonderful stack meeting up in Martha's Vineyard. Tribes were very well represented there, and it was very empowering to hear how each operating division is following up on what tribes are asking for. And tomorrow night I'll be joining the Secretary down in Phoenix, where we'll be visiting the Salt River Tribe on Wednesday. And we'll also be visiting a sober living facility in Phoenix that's predominantly Native American. And so the Secretary is very committed to this cause and has challenged me to work with our leadership across the agency to ensure that tribes and their equities are met and recognized. On the IHS front, Wednesday they'll be having a listening session here, and late last week they issued a Dear Tribal Leader letter outlining some consultations that will be on the IHS realignment. That'll take place in mid-December and in January. So make sure that you guys are sending folks in there to offer feedback. As I mentioned at the beginning, we really want to make sure IHS is a modern healthcare system, and we really need honest, critical feedback to make this work. Again, we're celebrating 70 years of the Indian Health Service, but how do we set ourselves up for success over the next 70? One of the things that I also want to touch on is I've been working closely with the Assistant Secretary for Health, OASH, on our CCO deployment across Indian country. Back in September, the Secretary signed off on the largest deployment of our Commissioned Corps officers in any sort of deployment, but for tribes, and they took those appointments and are in our network throughout the country through the end of this calendar year. We have a new OASH director. His name is Assistant Secretary Christie, and so we're already working on what that looks like in 2026 and making sure that we're meeting the needs and adding capacity at hospitals and clinics that so desperately need that help. On the CMS front, as you guys may have heard, we have the Rural Transformation Health Fund. Those applications were due in November 5. So the team there are working hard to evaluate those submissions from the states. And I have to say, I'm very encouraged to hear the positive news from Indian country, who worked so hard with their governors and their state health directors to ensure that tribal equities were met in those applications. And so the Secretary and the CMS team, we're very excited to see what those applications look like, and they're going to be rating and evaluating those applications to the end of this calendar year, and we'll see significant announcements in the turn of the year. So we're very eager to see the news there. I also want to share out of CMS that Dan Grillman is our new CMS Deputy Administrator, and that Rachel Ryan Peterson will be the acting director for our Division of Tribal Affairs. So she takes over for Dr. Carroll, who many of you know. She's a friend and ally of Indian country, and so I want to thank her for her service in acting, but I'm very excited to see Rachel take that position as we endeavor to find a permanent director of that division. On the ACF front, our Administration for Children and Families, we have a new Assistant Secretary, Alex Adams from Idaho. We stole him from Governor Little. He led one of the departments there. And I have the wonderful opportunity of working with him and Andrew and Hope Lone Tree McDonald at the ANA. One of the things we're working on there is to ensure that we're timely reviewing 477 plans. I know there's been a little bit of discussion on some of the answers that ACF has given tribes on their inclusion for the 477 plan. What I will encourage those program directors to do is reach out, work with us. I think we've come to some resolution on a couple of different programs and their inclusion in those plans. Last week, the White House announced their executive order on foster care. This vulnerable community needs a lot of help, and this administration is very committed to ensuring that foster children have the services that they need. One of the things we looked at was making sure that ICWA was protected, because ICWA is the law of the land, and this administration stands by ICWA. One final policy update I want to provide while I'm here is we have a new Office of General Counsel leader. His name is Mike Stewart. He was confirmed in the last package of Senate conferees. And Mike is wonderful. He's from West Virginia, but I have to say, when it comes to 638 expansion through HHS, this has been a long conversation. Mike is very excited to get into that work with us. And so he is on month 1 of the job. Mike and I will continue to meet because we've heard it from the self-governance tribes, we've heard it from our staff that they want us to look at 638, and the secretary has pressured me to take a look at 638. And so now I have a partner in Mike and making sure that whatever solution we come up with is durable. So I look forward to reporting out in 2026 how those conversations go as we look at what 638 expansion in HHS actually looks like. Work continues at SAMHSA, CDC, FDA, ACL, HRSA, our Surgeon General's office, and NIH. I look forward to hearing your input on those operating divisions, and if I can ever be helpful, do not hesitate to reach out. I try to be very accessible. My email address is just my name, Mark, MRK.Cruz@hhs.gov. Please email me. Please get my work cell phone number. Text me if your tribe or your programs are having issues. I'm building relationships within the agency, and we're really troubleshooting things. I don't think we need more bureaucracy, so I try and troubleshoot things as quickly as I possibly can. So please continue to be good partners as we work to make HHS work for Indian country. So I want to end on a couple of different things here. Well, where are we going from here? So I think 638 is our first priority, but there are a couple things in my first 5 months since being at the agency that I really want to spend some time on. And the first is construction. We have a construction problem, and we're still working off the 1992 construction list. I just find that entirely unacceptable. So we need fresh ideas. We need fresh ideas, and we need engagement. Because if there's one thing the Secretary and I have been lobbied on the most, it's this. And we get it. When we go and tour and we see new state-of-the-art facilities, those are the facilities we would want to get care at. And then on the other side of the spectrum, they're doing the best they can with what they got. But you literally look at hospitals and clinics that look like they're out of an episode of MASH. And so there's got to be a way that we solve this problem together. And so whether it's creative financing solutions, some sort of investment fund, these are the things that we need your partnership on. Because right now we've got 8 or 9 facilities still on that list. And the estimated cost to finish that list is $10 billion. And the Indian Health Service budget and Congress have only been putting in just short of $200 million in that pot. And so at that pace and trajectory, it's going to take us another 40 years to finish that list, which I find entirely unacceptable. So I need to work with you, tribal leaders. Let's get that list done, or at least put it on a sustainable path to finish, so that I don't have gray hair when we finally get to the end of that list and make the next one, right? And then grants, we're going to have conversations around grants. Our resources are strained, and I really do think that our priority should be in direct service and direct care It should be focused on the clinical setting. And so we're going to be continuing to have conversations around, what makes sense, what doesn't make sense. Congress loves authorizing new programs, and then they send it to us, and they don't ask for implementation guidance. Over the years, priorities change, and so some of these things are no longer making sense. And so we really need to take a holistic look at the IHS grant program. So I really want to thank you all for your time this morning. I want to thank President McCarr for having me. I want to thank the host tribes for the wonderful conference. Thank you for accommodating my schedule. I was originally supposed to speak later in the week, but because I need to meet the Secretary in Phoenix tomorrow night, they're very accommodating. Thank you to the NCAA staff for doing that. The IHS team, I want to acknowledge a couple of my fellow political appointees. Dr. Kim Hartwig, in the middle there. Go ahead and stand and raise your hand, Kim. Dr. Hartwig joined our team. Give her a round of applause. She's our Director of Strategic Initiatives. And then I want to acknowledge Clayton Fulton. He's our new Chief of Staff from the Cherokee Nation. And then I also want to acknowledge one person who's been super helpful to me as I've started this role, and that is our Acting Director, Ben Smith. Go ahead and stand, Ben. Thank you for your service to Indian Health Service, Ben. Thank you for serving and helping the transition. As many of you know, from one administration to the next, us political appointees, we cannot do this job without proficient career civil servants. And Ben has been nothing but an absolute professional. And I can't thank him and his leadership team enough for helping make this transition seamless. On the IHS director front, I am working very hard with our White House Liaison's Office, and I was hoping to have an update for you this morning. However, I don't have that information just yet from Washington, D.C., so just know that this is a high priority. I'll be speaking with the Secretary when I see him on Wednesday about this matter, and I hope to have an update to share with you all very soon. So with that, thank you for having me here. Thank you to the NCAI board for having me here as well. And look at Secretary Kennedy and I as a partner. Look forward to seeing you on the road soon. Thank you very much.